Hi, I'm Jen Kay, and I'm here today at the Arizona Natural Health Center in Tempe, Arizona. I am so excited and honored to be hosting this segment of natural remedies for common and sometimes not so common conditions. Today's segment focuses on bipolar disorder and depression and how this can be treated using natural remedies with a whole person approach. I have the joy of introducing to you today Dr. Tara Peyman, who's one of the magnificent doctors here at the Arizona Natural Health Center. Dr. Peyman, welcome.
Thank you.
I'm glad you could be here today.
Thanks for having me.
Absolutely. I want to ask you because bipolar, the term, has become such a common phrase. Oh, he's so bipolar. I'm feeling a little bipolar. What really is bipolar disorder and depression, and what are some of the common symptoms associated with them?
Well, thank you for asking that question. I think it's really important to recognize that, it's normal to have a day or two where you're down or you're feeling a little restless or anxious, and that doesn't mean you have bipolar disorder or depression. Really, if you have, a persistent period of time over several weeks or months where you're feeling low mood, fatigue, lack of motivation, loss of interest in things that would normally make you happy, and it's really interfering with your life, that's when you may actually have depression. And if those symptoms of depression then alternate with too much energy, feeling way too happy, overconfident, impulsive, restless or irritable or agitated, those symptoms are symptoms of mania. And so if you have alternating episodes of depression and mania, then that would be potentially bipolar disorder. And it is something that needs to be diagnosed by a physician.
So then how would someone actually know? I mean, if, there's times in our lives when we're sad, someone passes away, we have stress due to economic changes or changes in the workplace. How would someone actually know if they've got depression or bipolar disorder?
If they have depression or bipolar disorder, or if it's just situational.
Correct.
Well, the difference would be that people who have bipolar disorder or depression don't necessarily have anything else going on. There's not necessarily a reason. You can't say, well, obviously I'm down because I just lost my job. It's a situational thing. My mother just passed away. That's a horrible, traumatic event. So it's normal to feel stressed and down and, and experience symptoms of depression for a period of time, or symptoms of perhaps mania for a period of time if something really exciting is happening in your life. But if those symptoms then persist beyond the amount of time where you're actually in that situation, then that's when it could actually be bipolar.
Very interesting. So if let's say you come to these terms and maybe you've even got a diagnosis, and as I understand what you said earlier, some of the best ways to do is then find out from a clinical perspective if that's your actual, here's the symptoms, go find out. How do you actually treat that? I mean, what treatments are there for bipolar disorder and depression?
Well, there are a variety of treatment options.
Okay.
Generally, if you go to a conventional medical doctor, they would give medications, and there are different medications that can be used for depression or bipolar disorder. First, the most important thing is, as a part of diagnosis actually, is to rule out underlying other medical conditions like hypothyroidism or anemia or other things that could cause those symptoms. So if those are causes, then those would have to be treated as well, either with medication or other supplements. And then if you go to a conventional doctor, they would give, antidepressants, they would give mood stabilizing seizure medications often, or they would give antipsychotic medications like lithium or Zyprexa. Some of those medications can be very effective, but they can also have a lot of side effects and a lot of risks associated as well, like increased risk of diabetes or high cholesterol with some of the antipsychotic medications. And so that's one of the reasons that people might choose a natural approach instead.
Sure. So we hear a lot of things about side effects, and you have a very, that's the conventional approach. So with the medications and the pharmaceuticals that may be helpful, there's the side effects associated with them. You have a very different approach here at the Arizona. Yeah. So tell me, how do you treat some of these conditions here at the center?
Well, with bipolar disorder and depression, the very first thing that I do is I take a good amount of time to make sure that I understand, one, that the person is accurately diagnosed, because a lot of my patients do come in with a diagnosis of bipolar, and they don't actually have bipolar at all.
Really?
They actually have borderline personality disorder, they have PTSD, they have anxiety and depression, and instead of bipolar.
PTSD, post-traumatic
Stress disorder.
Okay.
Some other, mental illness perhaps that may look like bipolar in some ways. It can cause interference in sleep, it can cause changes in mood, it can cause a lot of other symptoms that overlap, but it may not actually be bipolar. So that's the first thing that we do, is make sure that the diagnosis is correct.
Okay.
Next, we do some tests, perhaps, again, to rule out underlying medical conditions that may cause those symptoms. And then as far as actual natural treatments, then we can proceed to offering homeopathic medicine, which is the best way to treat bipolar disorder, I think.
So would you be willing to share an example, perhaps, of a patient that you've used homeopathy with, that you've seen successful results with?
Sure, absolutely.
Great.
One of my favorite cases came to me last year. She's in her 30s, and she struggles with bipolar 1, which is the most severe type of bipolar disorder. She had suicidal depressive episodes alternating with psychotic manic episodes. So she was having hallucinations and delusions with her mania. So it was very, very severe. When she came in to see me, she was taking several medications for her mood disorder, and they weren't working really at all. Wow. She was having a lot of depression, crying all the time. Her husband came in with her, and she was in a wonderful relationship with him, but she felt like she was at fault for everything all the time, and she kept, going on and on about how, she was just struggling and suffering so much, and her husband was trying to be supportive of her, but she just couldn't. She couldn't come to a place of happiness despite the fact that there was nothing wrong in her life,
Sure.
And so I asked her to describe her depression to me, and she said that when she's depressed, she feels a welling up in her throat, as if she has something stuck in her throat, and it makes her want to cry, and she feels like she has to suppress it and hold it in so that she can act strong.
Okay.
And just go on throughout the day. But she doesn't feel strong at all. She's just suppressing all of her emotions and then crying when she's alone. And I took the rest of her case. I had her describe the rest of her symptoms to me, and it turned out that she needed a homeopathic medicine called Ignatia Amara. And that medicine can treat bipolar disorder with this specific set of symptoms, especially the symptom of the throat.
The suppression.
The suppression of emotions with, like there's something stuck in her throat. That's what she felt.
Okay.
And so I gave her this medicine, and she felt completely better. I saw her a few weeks later. She said that within about a week of taking the medicine, her depression was gone. It wasn't just better, it was gone.
I need to stop you. So within a week of taking this particular remedy,
yes,
the symptoms of her depression were gone?
Were gone, yeah.
Completely?
Completely gone, 100% gone. So not to say that they were going to be gone forever with just this one potency of Ignatia Amara,
sure.
But at that time, they were completely gone. She was no longer crying all the time. That symptom in her throat was gone. She also was no longer having headaches. Her digestion had improved. Other sort of side symptoms had improved. Her fatigue was completely gone. She felt stable and functional, and suddenly she realized that she had a wonderful marriage and she had a reconnection with her husband, and it was just so rewarding to see that, And then there's the issue of managing the case, so then she ended up having a change in her job, and that was a little stressful to her, and so she stopped responding to that potency of Ignatia, and she needed a change in the potency. At that time, though, she didn't get all the way back to where she was before. She just didn't feel quite as good. So we made a little adjustment, and then she was all better again, And so I've just been managing her case over the past year or so with this one medicine, changing a few things over time, and she's just doing wonderfully.
So you really take the time to look at the whole person and what's going on in their lives, and there's ways to maybe adjust the potency,
right.
As you said, but it's really, it's a way to create sort of a stabilization that helps them with everything. I mean,
Right.
it's not just one symptom. It's
Right.
it's bringing them all together. Is that right?
That's exactly right. And that's the whole point of homeopathic treatment, is that it doesn't just suppress the symptoms. It doesn't suppress the symptoms at all. It works with the body.
Okay.
And, you know, to really bring a natural state of health and balance and real remission, you know, real recovery. It's not just a cover-up.
Well, clearly, and to have greater joy with less effort, more fun,
Right.
less drama, less
Right.
crisis in your relationships
course.
must be so so rewarding both for them as well as certainly
Right.
for you.
I mean, my favorite thing is that I can come into work every day and see my patients tell me that they feel like themselves again. It's just such a wonderful thing to be able to experience.
That's such a great story, and I'm sure you have tons more that
I do.
people who are watching this are going, oh my gosh, that would be so helpful for me. Tell
Right.
me more. And I know we've only got so much time left. Would it be as simple then if someone I loved and cared about, that I suspected maybe they had bipolar disorder, if I thought that I did, or I was suffering from depression, is it as simple as maybe making an appointment with you or one of the doctors, here at the Arizona Natural Health Center?
Absolutely. We offer free 15-minute consults, and I love to explain a little bit more about what I do and hear, my patients' stories so that I can tell them whether I think I can help.
Fantastic. One last question. Are there anything you'd suggest that people can do at home, tips, techniques for either to recognize or to maybe even prevent and give themselves some sense of peace of mind?
Sure. Actually, yeah, there's a lot of things that people can do on their own at home to stabilize mood. One of the best things that you can do is exercise. It's not only good for you overall, but it's actually really good for mood stability. Even if you're feeling depressed and feeling fatigued and can't imagine getting
even
up
if you
and
don't want to
exercising,
you're like, oh no, I'm too tired,
Right.
I'm too depressed, I can't get up. Get your butt up.
it still makes a huge difference. All you need to do is just a few minutes. Just get up and do a couple push-ups, do a couple sit-ups, run for a minute. That actually can make a difference in stabilizing mood, increasing endorphins. It really can help.
Fantastic.
Just one thing that can make a big difference.
That's a great tip, and thank you so much. I know you're so busy, and so appreciate you taking the time to be here and share with people about bipolar and depression today.
Absolutely. Thank you for having me.
Thank you. I hope you found our segment today on natural remedies for common and not so common conditions as informative and helpful as I have. I strongly suggest you watch the other videos in our series so that you can see more how natural remedies can be of benefit to you. I'm Jen Kay, and on behalf of myself and the doctors here at the Arizona Natural Health Center, thanks for watching and have a great day.